must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show. Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcasts. My name is Brandon Pollen, and of course, as always, I'm joined by my fellow co-host, Dr. Stephanie Wyrock, and unfortunately, F. Scott Fiel, our other co-host, is unable to join us this evening because he's got some other stuff he has to do, but today we have the pleasure of welcoming two very special guests for a dive into the topic of PTA education, as today we welcome Drs. Tawny Chamberlain and Shannon Herrin onto the show today. Now, for those of you who aren't aware, Dr. Tawny Chamberlain and Dr. Shannon Herrin serve as the department chairs for South University's 11 PTA programs, as well as the program directors for the Richmond and Austin campuses. Now, prior to joining the university in 2011, Tawny primarily practiced in acute and subacute settings and recently became a board-certified clinical specialist in geriatric physical therapy. Shannon practiced in outpatient orthopedics and aquatics for 12 years and supervised a large private outpatient clinic in Southwest Austin before moving into education. And, thank you both so much for your service to the PTA professions. Do you think you can kind of tell our audience a little bit more about who you are and your story with how you got into academia and what you're currently up to nowadays? And Tawny, let's start with you first, and then Shannon, we'll follow up with you after that.
Sure, we're happy to. So for me personally, I have always loved education. When I got my bachelor's degree, I actually started teaching at a community college shortly thereafter. So I was in grad school and I was teaching medical terminology, and I just loved education. And I loved education throughout my career as a physical therapist. My favorite part was educating other members of the healthcare team and patients and their families. And so for me, it was always something I had in the back of my head as something I wanted to do. So I was lucky enough 7 years ago to get an opportunity to do that. So I still practice a little bit, just PRN in the hospital, but of course my full-time job is here.
And for me, I think a lot of us in education have similar stories. I think PTs and PTAs are natural educators, which makes for a good instructor in the future. And so when I went back to get my DPT, I chose a program that had some education as part of that teaching formal education at Boston University. And so I knew that was my goal. Making the jump was a little bit scary. Like I said, I was working supervising a very big clinic, and then I had this opportunity to jump into PTA education as a clinical coordinator, which was scary, but I did it and never looked back. And so it's a joy to teach students. It's a joy to work with Tawny and my other faculty. So I feel very fortunate for that. Tawny and I have gotten our feet wet with our own programs, and we have, not last CSM, but the CSM before, we got to do some research and present that. And that was pretty exciting to be guest presenters. And so I think our focus after this next reaccreditation visit with CAPTI will be a greater focus on researching in this area, because as PTA educators, we don't really receive release time for scholarship, but Tawny and I have made it a focus and a part of what we want to do going forward to help serve the PTA field.
I love that you guys are so dedicated to serving physical therapist assistants and therefore our profession as well, because PTAs are such an integral part of what we do. I used to work in a practice where we were in a rural area, and the PTA that I worked with, I learned so much from her. And one of the things that I learned is that PTA programs are extremely rigorous. I, never never knew that in PT school because I don't feel like we got a really great overview of what PTA education entails. Do you think that you could explain to our listeners about what PTA education consists of, how it's structured from the didactic and the clinical portions?
Yeah, so most programs either are continuous, meaning that your gen ed is integrated into your program, but many of them are structured 1+1, where you complete your gen ed, whatever that looks like, and then you apply it to a separate, what we call technical phase, the gen ed and technical phase. And it depends on the program. CAPTE gives us a maximum time frame, which people always think that we're saying minimum time frame, but CAPTE says we have to complete everything in about 2 years. So 5 semesters, 104 calendar weeks, or 80 academic weeks. They give us a little flexibility. So we have to pack all of our didactic and clinical content into that time frame, which makes it very difficult, just like you were saying, Stephanie. And so most of the time, the didactic curriculum is presented first. We do have to have an integrated clinical, which typically for most programs is part-time. It could be a full-time. And then the clinicals are typically completed towards the end and vary in length. For example, for us, we have a 2-week part-time clinical earlier in our curriculum. And then later on, we have a 6 and a 9-week clinical externship. And so it varies per program, but a lot of them are structured similarly to that. And so again, just can't emphasize enough that we have to get our content in that short period of time and cover everything that our community needs, what CAPTE wants us to do, and what FSBPT is going to test our students on during the licensure exam.
I think that's really an important point to really bring up, especially as you kind of overall mentioned some of the struggles and some of the things that you guys have to keep in mind with kind of developing and really implementing a program of this magnitude. You know, from mentioning, of course, that CAPTE has a maximum amount of time that they want for the didactic, clinical, and then, of course, FSBPT. But let's take that in a little bit of a next level here, if we will. So, you know, what are some of the other, or if you want to further iterate on some of these issues, but what are some of the biggest issues and problems with PT education across the U.S. that you guys have noticed?
Well, I think the best place to start is to piggyback off of what Shannon just said, that we are essentially being asked to do almost a bachelor's worth of education in an associate's degree time. And APTA and CAPTE and FSBPT, you know, when I first got into this, I assumed that all 3 of them talked to each other and that they were all on the same page. And it was kind of a wake-up call that they're not at all. It's not their intention to make life challenging. They have their own goals. They have their own requirements. And so we really have some issues kind of reconciling how we're going to meet all of the requirements in such a short period of time. So one big thing that came up at CSM this past year is we always go to the PTA educators SIG meeting. And this, of course, as it is many years, was a huge topic of debate. And Catherine Giffen, who is the chair, she kind of did a poll, and then based upon that meeting, she sent kind of a formal letter to CAPTE, which was essentially, yes, we're asking to do a lot. And when she took the poll, she found 51% of educators said that the current model of PTA education was not sustainable. About 30% said they weren't sure. So that only means about 20% said yes. So if only 20% of your educators feel that the current model is sustainable, we've got a huge issue, and we feel that pinch every single day. Our students feel that pinch every single day. Like Shannon said, you know, we have a responsibility to meet the needs of our community, but that's so hard to do sometimes, depending on what the topic is, if it doesn't align with what they're going to see on their licensure exam or what CAPTE is requiring. So we really struggle to meet the needs of all of those key players at the same time.
You know, I would like to kind of add something to that. I totally agree with what you're saying because there is such a huge volume of information that needs to be presented within that 2-year curriculum. And I'm a huge proponent, and I don't think that physical therapists do this as well, of mentorship. So like when a PTA graduates from PTA school and then starts their first job, a lot of times the physical therapist is not mentoring the physical therapist assistant to do what they need to do. And so I think sometimes physical therapists, if they don't have a great experience that first time with a PTA, they put it all on the PTA. And really what needs to be done is the physical therapist needs to take responsibility in coaching that physical therapist assistant, that new grad, the same way that they would coach a new physical therapist in their clinic. So I'm wondering what your guys' thoughts are on that statement and how you have taught your physical therapist assistant students to advocate for themselves in order to reach out for mentorship.
I think that the most important thing is what we teach them going into their clinical affiliations. We call them clinical externships. And one of the things that I tell students right from the get-go, and I work with my clinical coordinator, is having the students meet with the clinical instructor, not just to learn the basics of the clinic in the beginning, but to set those expectations. This is what I know as a student. This is what I haven't learned. This is what I would like to learn. What do you expect of me? And I think we can carry that over to employment, whether it's a PTA that's going to be working with them maybe as a DOR, or if it's actually a physical therapist, they're supervising physical therapists, which all of them will have. And I always tell my students that if you don't like people telling you what to do, you got in the wrong field, because you're going to have a supervising PT. But with that said, I think that mentorship, like you said, Stephanie, is really important. We teach our students in the introductory course that role socialization, getting used to your role, takes about 2 years. And so, as you know, in healthcare, it might be like, hey, here's where the bathroom is, here's where your patients are, let's go ahead and get started. And I think we really have tried, and I know Tawny does the same thing because we share a lot of our curriculum, which is a wonderful thing, is that we try to teach them that they have to solicit for that help, because sometimes other people don't understand that they need it. And I'm sure PT students feel the exact same way going in. But I do think in general, I'm in a Doctor of Leadership program. We have lost throughout many different industries and fields, we've lost the importance of mentorship, either because we're short on time or we feel that there's competition with the person that we're mentoring. And so it's up to us and our community and the APTA to continue to push that. And that if we are working in a clinical setting, that we bring that to the attention of our leaders, that's an important aspect, because not only do we don't want burnout. We see that in a lot of healthcare fields, and we certainly don't want someone to make a mistake and hurt a patient because they're not just to that level. We graduated generalists. We can't address every single situation as educators, and so they need to have the comfort level to be able to go to someone and say, I need help.
I think you make a really good point there, because, I mean, one of the biggest things that I have heard from supervisors who manage a lot of younger graduates is that they don't really understand how to manage these new millennials that are coming in. And really the number one thing that millennials are looking for in their employment is mentorship. And if a company is not offering that mentorship, the company is not going to be able to retain those millennials in order to provide the quality care that that practice needs to provide for the population that they serve.
Absolutely. And I think to kind of piggy off that point there just a little bit, Steph, just to kind of, if there are any PTA students listening in on this right now, if you're going for a job, please make sure that you clarify exactly what mentorship means when a job says they offer mentorship. Because just because a job says they offer mentorship, that does not necessarily mean that's the level of mentorship that student needs at that time, or it may not be very quality or frequent. I'm not saying that there's not clinics out there that do. There are some clinics that absolutely do a fantastic job, but there are also clinics out there that you go and they say they have mentorship and then it just gets rushed under the rug and then it's all productivity. So, I mean, I think that that's just an important point to students that, really make sure you get an objective, written out, clear understanding from whoever you're interviewing with about what that specifically entails and what's the form or structure of it.
But not only clarifying that with the employer, but looking for people that work for the company and getting their perspective on mentorship, because they're going to be more telling of what that company is actually doing versus this person that's trying to hire you.
I agree. No, I think that's a really good point. And, earlier kind of talking about, as you guys were saying, again, these issues with mentorship and such, I hate to murky the waters here a little bit, but I think we also have to have an honest discussion too about the options for PTA for further development are and how different that is from maybe from a PT. Because it was interesting when I did the guest lecture for Tawny's class and I was looking for resources or further ways for development, it was a lot harder to find some of that stuff for PTAs compared to PTs. It's definitely harder for sure. I don't know if Tawny or Shannon, you'd like to follow up with anything after that too.
Yeah, I mean, you're exactly right. A lot is planned for the PT, but not as much for the PTA. And I think that, over the years, PTAs have done a better job of advocating for themselves and kind of demanding some options. But I agree that they're still not fantastic. And I think that the need is there. I believe and I hear my students asking for more things and more options. So they want it. We got a little ways to go.
And, the APTA does offer the advanced proficiency pathways. It's sort of like a certification, but for PTAs. And they are starting to grow the different areas. For example, they have pediatrics, and they just recently, I believe, released orthopedics. And so they have some of those options, which is a good way to move if you're looking for something that's similar to a certification. You all might also know that some continuing ed courses allow PTAs to attend and some do not, regardless of state licensing requirements. And I live in Texas, and Texas has pretty broad allowances for PTAs and what they can do, but of course they might be restricted from continuing ed. Interestingly enough, some of the bigger continuing ed companies are beginning to start some of their own certifications for PTAs, and that's beginning as well. And I think that you're going to see, just like PTs are interested in that PTA students will be interested in that as well.
So you guys have mentioned, we've been talking about, some of these issues within PTA education, within mentorship. What do you think are some potential solutions to these specific issues, as well as maybe ones that we haven't talked about yet that you find are important to cover in this podcast?
Well, if we go back to the poll that was taken at CSM this past year, of course, in the past, they've brought up taking PTA education to a bachelor's model. That was turned down. And at CSM this past year, 61% of educators in attendance felt that a multiple entry level system was the best fit. So that would kind of parallel maybe nursing education, where I'm not sure what the best way that would look like, but maybe you start as an associate's degree, there's an option to get a bachelor's degree, and then of course continuing on to the DPT. But that allows a viable entry point for our students. A huge problem with having bachelor's as the entry point is we're going to exclude so many exceptional therapists. We're going to exclude students who maybe can't afford it, or it's not the right time in their life to give up 4 years for education. Diversity is a huge issue in both PT and PT education. And I'm sorry, but if you make bachelor's the entry level, we're going to harm diversity, not help it. We already don't look like the patients that we serve. And I think increasing to a bachelor's degree would harm that. So I was happy to see the poll that at least the educators in attendance this past year kind of agreed with the multiple entry points. And so, I hope that maybe that's a viable future to try and get in the education that's needed while still allowing a wide range of candidates to enter our field.
And that's directly tied to reimbursement. You all may be familiar that when they decided to remove the hard cap for Medicare in the future, then to offset that cost at the last minute, they said that in 2022, they're going to begin to reduce PT reimbursement to 85% of the PT fee schedule. And we were at CSM, and again, they were talking about that, and the lawyers and some other advocates that work for APTA said, again, it was a shock. They didn't know it was coming. And so maybe a justification going forward is, yes, a reduced fee schedule if you're entering at the associate's level, and as you progress to a higher level, then your reimbursement also goes up, similar to what Tawny referred to in other fields.
I think those are some really important points. And I think, just to kind of piggy off that a little bit, you've talked about definitely some interesting solutions that could take place there. But besides what you guys have mentioned, do you guys have any thoughts on what some of the barriers would be to maybe some of these solutions?
One of the barriers
Go ahead, Tawny.
if schools can offer the education. I mean, that was a huge barrier to moving to a bachelor's program. Was there was some concern that community colleges wouldn't be able to offer that. Although I think that people are really trying to work towards a solution there.
I agree, because most community colleges only offered associate's degrees, just like Tawny mentioned. Again, I'm in Austin, Texas, and our community college for the first time ever is going to offer a bachelor's degree. They're doing the RN to BSN degree, Bachelor's of Science for Nursing. And I think that if they're able to do it, and it's a bridge, again, they have the RN degree, and now they're going to offer this BSN, that could be a potential solution. We could use that as a model. Sometimes PT is a little behind. OT has sort of this step-up program when it comes to education. Nursing has it. And so I think getting anything agreed to and implemented can sometimes be a little bit challenging. I think sometimes PTs, they have good opinions, but sometimes those might differ, and it makes it for a hard time getting to a decision. And so I do think that the APTA, along with CAPTI and so forth, could work together to help create that system, and what would that look like and how it would be implemented. Typically, it's a step at a time. It's not everything at once. Just like we went from bachelor's to a master's to a doctorate of PT. I think we can continue to do the same in PT education.
So I think that's really interesting to really get that perspective on some of the barriers that would take place. And of course, my mind initially goes when we're talking about this is, as prospective students, how does this look from a cost standpoint, with doing all these different routes, and how does that change things? And, before we get into that a little bit more, just to have a discussion on that, what is the average cost of completing PTA school in the U.S.? And, to kind of compare that, what is the national average salary of a new graduate and of an experienced PTA in the U.S. as it stands now?
I'll take this one. So we actually looked up, CAPTI publishes what they call aggregate data annually. And so their 2017-18 report, public in district, the average was $12,276. Public out of district was $21,606, and a private education was $38,900. So as you would expect, quite a dramatic difference in average between the public and the private sector. We also gathered some statistics. Various websites online have a pretty good range for salaries, but if we want to count, Bureau of Labor Statistics is kind of the ultimate authority. Well, first of all, it's always, with both PT and PTA, the projected growth is always strong. So for PTAs, it's projected at 31% from 2016 to 2026. So that's always good news, with the median salary of $57,430. And so you would ask, I believe the highest 10% earned was right around $79,000, of course, with higher wages and home health and skilled nursing facilities. And I think we see that with our students too. I mean, there's definitely quite a wide range, especially once they've been out there for a few years, depending on the setting they're in, how much need there is.
And I think we sometimes also see a difference per state, because certain states allow PTAs to do more, like Texas, or to do less in some other states. And of course, pay then is going to vary accordingly.
Sounds like a pretty good return on investment for 2 years of school, if you ask me.
Absolutely, it is.
Yeah. With both of you being responsible for the assessment and accreditation process, system-wide for South University, I'm curious to hear your perspectives on what this specifically involves. So if you could kind of brief us on what you both have gone about doing for assessing in the accrediting process for South University.
Well, to start with, whatever you think it is, it's a dozen times bigger. It's the most enormous process either of us have ever went through. We never could have imagined. I mean, we totally didn't know what we were getting ourselves in for, did we, Shannon?
I always tell people that I have 5 children, but the hardest thing I've ever done is the initial accreditation process.
Yeah, and on top of that, CAPTI, of course, they change their rules regularly, I would say about every year. So I think both of us had that moment where we're like, okay, we're accredited, we got this, we know what to do. And then CAPTI sends out a new set of rules. and then they send out a new set of rules. So luckily they do have self-study workshops, which are critical to attend, being incredibly organized, being on top of your assessment process, similar to documentation with patient care. You know, if you didn't document it, it didn't happen. CAPD has the exact same rule. If you didn't document it, it didn't happen. So if that's a quick conversation with the ACCE about what you would consider a small item, if you don't write that down somewhere, then you didn't have that conversation. They fully expect documentation of everything, especially of the assessment process.
And I think that CAPD gives us guidelines. They have standards and elements, and it's pretty involved, anywhere from talking about your university policies, how your policies align or don't align with the PTA policies and how you address that. It talks about ensuring your faculty is qualified and how you assess how they are performing. How do we assess ourselves when it comes to the success of the program? The three major metrics that all programs look at are graduation rates, licensure rates, and employment. But in addition to that, we want to know, what are our students saying formally and informally? What does our program advisory committee say? How does that relate back? How do we use that information and improve our program? And how do we educate our clinical faculty, and how do we assess our students to ensure that they're entry level? And it is a massive task to create those systems, monitor those systems, document, like Tawny said, and then prove to CAPD when they come that that's actually what we're doing. And so it is a time-consuming process. I do think that sometimes we forget that there's a benefit to that. I'm a better program director, I'm a better faculty member because of some of those policies and rules that they have. At some point, it does sometimes seem a little bit overwhelming. And I think that all program directors can get on board with that statement.
Well, with you saying that there's a lot of things that you've figured out through this, what have you all both learned from this process?
What haven't we learned? I got to be honest, one, I think slightly surprising thing is when I first tried to wrap my head around the assessment process, I don't think I really understood it. Now I feel like I have a really good handle on assessment process, and it's become so crystal clear to me that every business essentially needs to have the assessment process that CAPD is requiring. Everything that they're looking at, the fact that you're continuously, whether things are going well or not going well, you need to look at your processes, you need to seek feedback, you need to set thresholds, as we like to call them, for, hey, if I don't meet this threshold, I need to pay attention because this might be going in a direction I don't like. And if I do make a change, let's look at that change and reassess. How did it work? Just like with our patients, we changed the plan of care. We're continually reassessing to see how that's working. Should we do it with the next patient? And so the assessment process, once you really wrap your head around it, is very intuitive. And I've actually kind of found myself recommending it, like, to my husband with his business, or, kind of in other facets of my life where I find myself using these kind of assessment.
We work with our accreditor specialist a lot at CAPD, Lisa Finnegan, and she's fantastic. They're not out to get you. They're out to help you provide the education that you say you're providing to your students. So we fully believe that. And if I can make any recommendation to anyone that's new in this setting for education, is to start early. Don't wait to write that report a couple months before, and to create a system for yourself. Of course, you're going to refine your system. I started with a very small outpatient practice. It was me and the owner, and by the end, it was so big. And of course, things had changed, but we created an infrastructure and then we modified it. And so, starting with something, a way that you're going to document communication, the way that you're going to track assessment. Tawny created this amazing OneNote tracking document that she shared with me, thankfully. That's why she's a good friend, amongst other things. So sharing and having resources, that was something that I had written down as well. In Texas, we're so big, we have a PTA Educator Alliance, and we get together a couple of times a year. And I'm telling you, those people are fantastic. I've had people share ways that they're assessing. I've had them give me ideas when it comes to structuring the report. And that information is invaluable, and it just shows that people are willing to work together instead of being competitors.
Yeah, I think that's a really important talk to have, especially mentioning a lot of these aspects regarding CAPTE. But let's go to kind of the other big elephant in the room here when it comes to PTA education. So of course, after an individual graduates from PT or PTA school, they have to study and pass the licensing exam put out through the Federation of State Boards of Physical Therapy, or more commonly known as FSBPT. And we actually have the pleasure of talking with Nancy Kirsch and Richard Wolf on the show in the near future. But, I really got to ask, because I know I've heard students talk about the licensure exam. I've heard educators talk about this too. But just to kind of get where you guys are at, what are your thoughts on the pros and cons of the PTA licensing exam as it stands now?
Yeah, well, Shannon and I both love Rich Wolf, so it's great that you interviewed him. Both of us have been item writers. I actually served on the 2016 Practice Analysis Task Force that kind of helped to start the process to reformat the test that's currently in place. So it's frankly, I think it's very impressive how they developed the exam. It's amazing the changes that have occurred from when, Shannon and I would have graduated when they didn't even have fixed date testing to now the metrics they use. I mean, they can see if the integrity of a question has been compromised, like almost in real time, from the morning to the afternoon test. So it's quite amazing how much goes into the test writing process. And of course, being an item writer, seeing it from that perspective and, all the evidence that we have to supply to support every single question and how they get revamped and how they get trialed. So the entire process, I think, is amazing. And they're always looking at ways to improve it. Right now, I think they're trialing some video type questions, which I think will be extremely valuable. Of course, it'll take quite a while before that would ever potentially make it on an exam. But, I think they're really trying to do their best to accurately assess someone's ability to be a competent entry-level practitioner.
Yeah, and I think for me, what made a lot of sense when I went to start writing items, I think a lot of program directors and faculty go selfishly to learn how to write better. And then you learn that you're also serving the field when you're doing that. And so as you're writing all your 20 or 40 items, depending on what you're doing, you're like, okay, I'm helping. But another thing that I learned was that the best way to do an exam, the whole purpose of the test is to demonstrate competence and to protect the public from people that aren't competent. But it would be to have an oral exam with some practical components. But that would be impractical. That was my pun intended. So anyway, the idea is that we can't do that. So they've created the best valid exam that they can to test knowledge, ensure that graduates have the knowledge they need to be competent and safe. And that's it. The thing that's made it so difficult is because they not only require or test on items that CAPTE has identified as important, they are testing the community. So they're asking people that are working in the community, such Tawny was talking about some task force, what is being taught, what in the clinic, or what is being used by PTAs in the clinic. And so that doesn't always align with what CAPTE has required of us. So sometimes we have to teach more to meet the requirements of FSBPT so that our students are successful on the exam. And so that amount of content can be challenging to study for. So that's why we try to incorporate board-like questions in our programs so that our students are prepared.
Yeah, I think that's really interesting to know. And I think something I'd really like to get both of your guys' thoughts on, because we had a guest not too long ago who talked a little bit about the board examination process, more for the PT realm more than PTA. And the worry that he kind of said was that with kind of teaching to the exam, do we lose some method of creativity or fostering creativity in students if we're teaching more, not all 100% to an exam, but if we're enforcing a lot of our curriculum on that? Do we run into some problems? What are your guys' thoughts on that?
I was going to say, I don't know about everyone's program or PT programs. I don't ever feel like we're teaching for the exam. I feel like our goal is to write our exams to mirror the board exam, so that the level of critical thinking, the level of integration, to where it's not just asking for rote memorization of, the normal range of motion of the knee. It's the knee, and then you're incorporating kind of several other steps past that. And so I think once you kind of learn how the board asks their questions, I'm not teaching the DARE test. I'm teaching students kind of how to think similar. I think another critical part is that this is where CAPTE and FSP PT are actually working well together, in that a student can't sit for the exam until they graduate from an accredited program. And for us to be accredited, CAPTE requires at so many steps to show that students are competent and safe to progress. And so we have to prove in every class, with every practical, with every checkoff, that student is competent and safe. And that is more than an oral exam. That's a practical exam and an oral exam, and it's backed up with written. So you're right, that final stepping stone, that final path to get the license is indeed a written exam, but the first 100 steps were anything but.
And today I was reviewing our midterm exam for therapeutic exercise and orthopedic applications. And it's my class, and it's the hardest class. It's applying everything from kines and patho and so forth and putting it together. And it's intense. But what I told them, sometimes they're like, well, you were trying to trick us. And I said, my intention is never to trick you. But remember, when you're taking a multiple choice exam, the answer is sitting right there in front of you. So the distractors have to meet a requirement to where someone that had not studied properly, had not taken that extra level of critical thinking, that they're distracted away from the correct answer. Because I don't know about you, I don't want anyone treating me that can take an easy test to select it. And I'm sure your guest did not mean that whatsoever. But we have to be careful, because it is hard to make a multiple choice exam rigorous, but also valid. Because we also have to throw out those questions that are too easy, too complex, too hard to understand.
Yeah, so we've really hit on a lot of different aspects about not only just test writing, about being a PTA program director, but also just about the curriculum itself. I'm interested in hearing what the biggest and toughest barriers are that you both face being a PTA program director, and how you've overcome these barriers, especially in a world where not every physical therapist agrees with the importance of a PTA.
Well, I think that the barriers that we face the most, I think you've sort of hit the nail on the head when it comes to a different generation of students. Don't you remember when your teacher said, or your parents said, well, when I used to go to school, or when I taught this class? And I think we forget that sometimes we're turning into those people, and we have expectations of how we were in school. For example, when I went to school, there was no rubric. We took the test, we went into the practical, they gave us our grade. I have no idea what I did right or what I did wrong. It wasn't wrong, that's how they did it. I trusted their expertise and their judgment. Nowadays, everything has a rubric, and you might see a student fighting over a point that's probably worth 1/1000th of their grade. And again, this generation that is currently doing all these tests is because that's what they've been raised to do. They're achievement learners. They have been taught that there's a right and there's a wrong, and there's not a whole lot of gray. We have to sort of transition those students, because as you know, healthcare, and especially physical therapy, there's a lot of gray. So that can be a huge barrier for educators, but it's not unique. And again, it's not unique to this generation. This generation is focused on service, which is amazing for our field. This generation is focused on getting it right so they can do well. And I appreciate that, because again, I don't want someone that's just like, well, whatever, going into it. So I do value those things. And Tawny, did you want to add something to that as well?
Yeah, well, something Brandon first started with in terms of, or maybe it was Stephanie asked, kind of one of the barriers of people really not knowing how to utilize PTAs appropriately. I'm one of those people where if I'm going to complain about something, I'm going to try my best to be part of the solution as well. And so I am able to speak with PT students before they graduate as part of a course at Murphy Deming's CPT program. We also team up with VCUs PT program, but at Murphy Deming, I go for a decently long lecture and really try and go over everything, misconceptions, how you can properly utilize a PT or PTA, the PT-PTA team. We do some games, and the feedback, it's always a little surprising that most of the information I'm giving them is brand new. And it's hard because PT programs have basically the same challenges we do, where they have so much information to cram into such a small point in time that I think some programs just don't feel that they have the room in their curriculum to really highlight the PTA and, maybe some of the rules and regulations with the care that a PTA can offer in their respective states. It's so critical though. So gosh, it may just be one lecture or two lectures, but I'm happy to go to any school who will have me and try and sing the praises of what a PTA can offer and how the PT-PTA team is valuable to patient care.
Your statement is well backed up by research. I mean, there's a lot of evidence that says that when you survey PT students or you have PT and PTA students work together, the PT student is not very comfortable or very much aware of what the PTA does. And sometimes even the PT student feels like the PTA student knows more than that, because a lot of these studies that are done in the last year of PTA school and like the first or second year of PT school.
Yeah.
So I think that's a really interesting statement that you made.
Yeah, Stephanie, that's exactly what we see when we pair up with the VCU program is that, they're brand new. Our students actually have had a little more curriculum. And the questions always catch me a little off guard. And it's so great. We try and let the students interact as much as possible. And, with very few exceptions, it's all very respectful interactions. But you'll hear questions like, oh, you guys are allowed to do manual muscle testings, or, oh, you guys know how to perform a Tawny. And the first thought to go in my head was, oh, well, of course they can. But the second thought is, oh, this is exactly why we're doing this. Thank goodness that we're doing this. And so I'd like to think that one cohort at a time, we're showing PTAs or PTs what PTAs have to offer and vice versa. And I think in terms of a huge thing our PTAs learn is don't be intimidated. You're all in the same boat. We're all learning together. We're all learning every day of our career, and we have the same goal in mind, which is whatever the patient's goals are. And so I feel like that helps break whatever invisible barrier might be there between the PT and PTA before they get out and start practicing.
And it helps that CAPTE has now required DPT programs to include PT-PTA collaboration in their curriculum. And so I think that's going to make a big difference because they're going to have to do that for sure. We have had to, and we will continue to do so. And I think it's just like what Tawny said. There's a limited amount of time, and sometimes you don't think about that being an important aspect. You think, oh, they'll get it at clinic. Well, what if they go to a clinic where there is no PTA? And so I think that it's something that's needed, and I think it's coming and will continue to be strengthened.
It's definitely promising to hear that a lot of these solutions are coming to fruition, especially Tawny, with you mentioning what you guys do. And also, I really liked a while back when we kind of exchanged for email what you guys do to also help PTAs become more involved in the professional association. So I think that's equally huge with that. And apart from what you both had already mentioned, just kind of a random question here, but what are the most uncommon things that you feel like most PTA students and even PTA faculty members aren't aware of regarding being a PTA program director?
Well, I think the first thing that people don't realize is that we do other things besides just teach. My students wander in anytime, any day. I'm walking out of the building. Oh, I have a question for you. And of course, we're here for the students. That's what we want to do. And because we at South, I'm not sure about all programs, we not only obviously administer our own program and teach our own students, the students that are prereq students and in Gen Ed, we advise them as well. So, we're all over the place, which I think is probably very common for most PTA programs. And so just the realization that we have quite a bit to do in regards to administration, faculty supervision, assessment, documentation of everything, and then along with accreditation. Most program directors are working some crazy hours, and it's worth it because of what we love to do.
Very nice. Tawny, did you have anything to add on to that as well?
I guess what we touched on earlier, which is the beast that is accreditation and the assessment process. I know when I was a student, I barely knew what accreditation was. I barely knew what CAPTE was. If I would have only known what my program director had to do, I was actually the second class to go through at my university. And ever since I've got this job, I just wish like I could see her and hug her and be like, oh my gosh, anything we ever asked you to do, I'm so sorry. I mean, now that we know what she went through to get us accredited and to keep a program accredited is a really big job.
And, one of my program advisory committee members, he taught for a while in a DPT program that was starting up just north of Austin. And he comes in and does an amazing guest lecture on kinesiotaping in one of our current rehab issues course, like a seminar course. And I loved him forever because last time he came, he told them how long it takes just to make one PowerPoint and write one quiz or exam. Going into teaching, I had no idea. It takes many, many, many hours, and I do a flipped classroom, so then I narrate it. And I always will remember the silliness where I'm like, oh, I have 60 slides. I'll just start at slide 1 and record all the way through slide 60, just like I do a lecture. I didn't make it through the first slide. So I learned from that. So I do think that it's nice when people understand that it does take a lot of time to prepare, grade, teach, all of that as well.
We've touched on lots of different aspects of PTA education in this podcast, and I have thought that this discussion has been very fruitful and intriguing. We do finish our podcast with the same question for everybody, and that question is, if you could change, and I know we've talked about some of these things, but if you could change one aspect of healthcare education, PTA or other healthcare provider related, which aspect would you change? And how would you change it? Feel free to mention something that we've already talked about or even something new that we haven't discussed yet.
I can start out in a word, prevention. I feel that the entire American healthcare model is spending incredibly way too much time treating symptoms, and we tend to disregard the cause completely. And causes are often diet and lifestyle related. And I think physical therapy is well poised to help with those things. And frankly, I think a lot of health professionals are well poised to help, but our model just doesn't seem to value that right now. And I know that when I practiced full time, that really got to me. I felt like all we were doing day in and day out is putting Band-Aids on things as a healthcare team, instead of actually ever helping the problem. Drugs, surgery sometimes fixes the problem, and a lot of times it's a Band-Aid. So I would love to see both PTs and PTAs play an enormous role in prevention, and gosh, I would love the entire healthcare system to follow suit.
And I really agree with Tawny. I had the pleasure of speaking with Shirley Sarman one time. She does the movement system impairment syndromes, and she's out of the Washington University in St. Louis. And first of all, she's a firecracker. Second of all, she really spoke very honestly of where she thought PT was headed. We already know we're sort of bottom of the barrel when it comes to reimbursement dollars. And she envisions, and I think it's just right along with what Tawny said, is being the healthcare provider of choice, sort of from birth to death in movement, all the things that we can do, that we know how to do it. Maybe we can help prevent things before they occur. Obviously, we have pediatric specialists that can identify certain things with gait. As people get older and they have small injuries, can we catch it early? Some of you probably live in states where you have direct access. Texas says they do. All we can do is do an evaluation. We cannot do treatment. That's a huge passion of mine. We have to get direct access. We're qualified, and research shows nothing bad happens when we have direct access, only good things. And so I think that along with the prevention, if people want to be able to help themselves understand how to move well, how they're moving dysfunctionally, and having that correction from an early stage of life onward, I think we're the people to do it. And I hope that we're chosen over time to be that healthcare provider.
And we've actually interviewed Shirley on this podcast about that very topic.
Yeah,
She's amazing.
We're movement experts. I mean, movement, if you don't have movement, you're missing out on the world around you. And we have health insurance to get our teeth checked twice a year, but somehow it's not common practice to have our entire body and our movement systems assessed on a regular basis. And that just seems crazy to me.
I'm loving the referrals to Shirley's most famous quotes. So that's great. So if you guys are listening to this podcast, want to kind of learn more about what our guests here are talking about with Shirley, we have a podcast that Shirley does talk about these things.
Which should be coming out in the near future, actually. So stay tuned for that. But ladies, thank you so much for your time and for speaking with our audience today, because I agree it was definitely a very engaging and informative discussion. I think I learned quite a few new things too that I really was not aware of regarding PTA education and the accrediting and all, and even within the exams and such. But where can people find you online or contact you if they have any further questions based on what you guys were talking about earlier?
I'm just at TawnyChamberlain@gmail.com is the best way to get a hold of me. Other than that, I kind of stay off the grid.
If you go to South University Austin, you'll find me, or South University Richmond, you'll find Tawny's contact information. And my husband, who's the tech guru of the world, has made a website, ShannonHerrin.com. It takes you to my LinkedIn, and I would love to be linked in with people that have similar interests or questions. We're always happy to help.
Well, sounds great. And thank you both so much for your service, your dedication, your hard work. Let's keep pushing everything forward. And thank you both for your time.
Thanks for having us.
Thank you.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available in our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.